Hi, my name is Jacqueline, and I had a left ankle reconstruction surgery 6 months ago. What led me to do the surgery was I had chronic ankle sprains for 10 plus years. I was an avid college volleyball player back in the day, and through my experiences, I just had repeatedly sprained my ankle over and over. So that led me to realize that I need to get something done. As I've gotten older, I have more issues with falling and spraining my ankle more and more, so I realized that it was time to do something about it. At my initial consultation, when I met with Dr. Wiernik, it was kind of a unique situation because I wasn't necessarily in a lot of pain, I wasn't having a lot of dysfunction per se, but I knew that over the course of time, I was definitely going to need to do something about my ankle instability. So it was kind of funny because even he was taken off by it a little bit in the sense that, well, why are you here if you're not really in pain, and if you can still walk and do your daily activities. But we did a specialized x-ray called a stress x-ray, and then it kind of shed some light, and he realized that, ooh, this girl really doesn't have much keeping her ankle together. So on that particular day, I went ahead and scheduled surgery because over the years I had talked to different doctors and that sort of thing, and different physical therapists, and they pretty much said that it's just you have no more ankle stability left because the ligaments are no longer there. So surgery was pretty much my last option. So we went ahead and scheduled the surgery, and I had it 1 month later. For those of you that are watching this, sitting there debating whether or not if this would be something that would help improve your quality of life or help you become more functional, I have to say that, I don't think that surgery should be anyone's first option, but if you're at the end of the rope and it's time to go see a doctor and make sure that you're having the opportunity to make educated decisions, Dr. Wiernik is going to be a great choice for you, because this particular surgery isn't necessarily a super common one, but with that said, we were able to go in. Our objective was to create a more stable ankle, and I have 100% achieved that goal. So that has been really, really helpful, and it will be something that I will be able to live a better quality of life and do the activities that I love because I went ahead and had this surgery. The day of surgery, this isn't my first surgery, so it was nothing new to me, so I do have something to compare it to, and my overall experience was extremely positive. The people at the surgery center were very knowledgeable, and they made me feel really comfortable. The big thing is no surgery is easy, and as I was coming out of recovery, I think is when I really noticed the most. Granted, you're a little out of it, but they were so caring, and they knew that I just wasn't comfortable, I was in pain, and that's just kind of the way of surgery. But all in all, they did everything in their power to make sure that I was comfortable with pain. I oftentimes get nausea with anesthesia, and they helped me with that. And to be honest, it was my best post-op experience that I've ever had, and I've had 5 surgeries. After I had scheduled my surgery with Dr. Wiernik, and I think anyone would feel a little apprehensive about any surgery, but I think I knew I made the right choice at my initial post-op appointment with Dr. Wiernik. He came in and he just kind of had an air about him, and it was the first time we got to actually discuss the surgery, and the first things out of his mouth literally were, "I've never seen an ankle quite like yours." And for me, that was kind of the take-home message that I had made the right decision, absolutely, because it's amazing how you can have all the x-rays and the MRIs, but ultimately it takes a surgeon to get in there and really see what's going on. And so for my experience, that was kind of the settling factor, knowing that he got to go in and see what was really going on inside of my ankle, and that I had made the right decision. As I'm now 6 months post-op, I have found that just my general quality of life, as far as feeling more confident when I go on simple things like take a walk with my dog, or we go to the park and we play around. Before, I just would constantly think about, oh gosh, watch where you're stepping, make sure you don't fall, and that sort of thing. And now it's definitely more in the back of my mind, just because, when you have ankle sprains for 10 plus years, it's hard to get over that. But I still get that feeling of, now Dr. Wiernik has fixed it, and I'm strong and I'm stable, And so it's just getting to that process of knowing that I can trust my ankle again. And actually yesterday was the first time I had played volleyball in over 8 months, so that was pretty fun. Dr. Wiernik was especially helpful with my post-recovery process. His bedside manner was great. He was always very caring, and ultimately he took all the necessary steps that it took in order for me to recover as quickly as possible. There were definitely times when I felt like I was better than I was, and he was really, really good about reminding me about everything that he'd done inside of my ankle and the actual surgery process and just how much time it takes to heal. And so he was super professional in sharing his expertise with me and making sure that I had all the facts and was able to make well-educated decisions on my recovery process.